In order to do the doll's hip maneuver, you're going to want to find the floor and lay on your side. Now, what's important for this one is you're going to want to be able to find your own PSIS, which is the posterior superior iliac spine. There's plenty of videos on YouTube where people show you how to find it. And if you already know where it is, that's perfect. So, in order to do this exercise, we're going to be engaging this little muscle called the multifidus. And it's a very small muscle that's really right next to the spine. So we're going to be activating the right side. So we're going to lay on our left. And so as you come over here, I'll show you that when you lay down, you want both of your knees bent like this. And I don't know if you can see in the video, but my top knee is just behind my bottom knee. So I'm not like this, I'm not like this. I'm just kind of sit nice and comfortable like this with my hips stacked and my knees bent like this. Now, what we're gonna do is very important that you know where your PSIS is, because I'm going to feel for mine. So mine is right here. Now I'm going to go medial or towards the spine, and there's a gap between the PSIS and the spine, and I want to put my fingers right in that gap. And so what the movement is, it's such a subtle movement. All I'm doing is really just trying to drive my femur, which is my leg bone, up into the hip socket. So I'm just slowly bringing right there. That's the movement. And I can feel a little bit of swelling underneath my fingers down here, and that's how I know that I'm activating it. And so I'm sitting here and I'm going to hold for 10 seconds or however long your program tells you to hold it for. And then you relax out of it. And how to relax out of it, you just take your knee away from your spine, and look at now. If you can see my knees are stacked. So where they were like this, now to release it, I just go forward, and then to re-engage it, I just bring that knee slightly back until I can feel right there, until I can feel a swelling underneath my fingers, and again I hold. And that's subtle. You don't need to be picking up your knee. You don't need to be flexing your knee, extending your knee. You don't need to be jamming and going super hard. It's really just this subtle shifting motion. And it takes a lot of inner muscular sort of awareness to get this right. But when done properly, it activates that multifidus very, very well, which is the muscle that we're trying to target. So that is how you do the doll's hip maneuver.